Nice day. As interns of the 8th semester of physiotherapy of the Maria Cano University Foundation, today we want to address a topic of vital importance for all of you, such as oxygen therapy. Oxygen therapy is the administration of oxygen at concentration higher than those of ambient air with the aim of treating or preventing the symptoms and manifestation of hypoxia. Hypoxemia is abnormal decrease in partial pressure of oxygen in arterial blood. Hypoxia, deficiency of oxygen in the blood cells and tissues of the body with compromise of the function of these. FiO2 is the fraction of oxygen expressed in concentration and measured as a percentage. In the case of ambient air, FiO2 is 21%. Flow, amount of gas managed measured in liters per minute. Oxygen administration is often necessary for patients with acute heart disease, lung problems, or stroke. Oxygen source, to pressure valves. The most common devices are metal balloons with compressed gas. Concentrators. These are electrical equipment that work by passing ambient air through a molecular filter which removes nitrogen and water vapor. They provide a gas that contains more than 19% oxygen. Liquid oxygen. These are low pressure reservoirs with low temperature oxygen, mostly known as oxygen plants. Fluidometer, instruments that allow to regulate the amount of a liquid or gaseous fluid depending on liters per minute. Oxygen humidifier, the oxygen provided by the different methods is dry, so it is advisable to add water vapor before it comes into contact with the airways to avoid drying the main excretions. Never use saline solution, only doubly distilled water. To bubble humidifiers. In the systems, humidification is achieved by passing the gas through water. Cascade humidifiers. They add water concomitant, increasing evaporation. Oxygen delivery device. Oxygen can be delivered from the source to the patient through low or high flow systems. Low flow systems. Nasal cannula does not provide constant oxygen concentration, provides oxygen concentration of 24 to 35% approx, flows from 2 to 4 liters. More expensive single oxygen. It can deliver a FiO2 of 35% to 15%, oxygen with flows of 5 of 10 liters per minute. Infrequent use should be considered in patient mouth respirator. Low flow venturi max. It uses a system to suck air from the environment and mix it with oxygen flow, giving exact concentration of oxygen. The FiO2 delivered depends on the flow of oxygen delivered liters per minute and the amount of ambient air stirring through the regulation, but it is very versatile. Low mask. They are characterized by having a reservoir bag. They are classified into two types according to the mixture: white ambient air, partial reinhalation of non-reinhalation. 1. Partial reinhalation effectively provides FiO2 up to 75% approx, always at 10 liters per minute. O2 is easily humidified. 2. Non-reinhalation provides FiO2 from 72 close to 100%, quickly, always from 8 to 20 liters per minute. O2 is easily humidified, high FiO2 delivery, 100% approx. High flow system. High flow venturi mask. The device work in the same way as the low flow venturi mask, presenting the same advantage and disadvantage. The difference is the oxygen flow it occupies from 9 to 15 liters, giving FiO2 from 35% to 15%.